Hello, everybody.
Good afternoon. We made it through the first day of the annual enrollment period.
And it was actually a really good day. So we are really excited about this year.
Yeah, I feel like we both really do love our jobs.
We do love our jobs.
It was a good day.
And we love helping people, and it's fun when you can save people over $1,000, $1,500 a year. So
yeah. All right, so we'll go ahead and get started. Welcome to From Our Family to Yours, Medicare Talk,
where we bring you real talk and real care because your health matters.
We're a mother-daughter team and the heart behind Health Matters Insurance.
And we're here to help you thrive with your finances, your health, and your life.
Every week, we'll break down Medicare in simple terms, answer your questions, and share tips to help you make smart, confident decisions.
Whether you're enrolling for the first time or helping a loved one, you're in the right place. And we're so glad you're here.
Let's dive in. All right, so we'll kick it off with your joke of the week.
Okay, so this one's kind of, whatever. It's easy to remember. So what did the perverted frog say?
Perverted frog. I'm not sure. What did
Rub
he say? That's a good one.
Easy peasy to remember.
Yeah, that's funny.
So
okay.
Paige and I were talking, and we were kind of going through our day, and we always kind of debrief at the end of the day, just seeing what we've discovered and what's new. Today, the big thing was it's so important to have a local agent run your drugs. Mm-hmm. Depending on what drug plan you're on, somebody, if they would have stayed on their current drug plan, next year would pay $2,700 total. And somebody would say, well, how could they pay that much? Because the max out of pocket is $2,100, but that's not counting the drug premium. And one of the drug plans is now $125 a month next year. So we switched them, and his total out-of-pocket cost would be $1,300. So he's saving. What is he saving? $1,500.
Yeah,
just
that's
by
huge.
Switching a drug plan. He's on a Medicare supplement, switching his drug plan,
and he doesn't have to do anything different. He just switches the plan.
Right.
So that's huge.
Came in, ran his drugs. We did the application today, and the plan will start January 1st. Mm-hmm. That's why it's important to have a local agent.
Yeah, and to make your own decisions for your plan too, because sometimes you might think your neighbor's really smart and you just do whatever plan they do every year. Or maybe you have a bossy older sister, kind of like I am, and you listen to everything that she says, but do your own plan. It's your own drugs, own medications. You have your own needs. Maybe you have a knee replacement you need next year. It's your own plan. So definitely do what's best for you, and we help you find the plan that's best for you.
Well, what's so funny is last year I had somebody call me and they said that's the best and this, that, and the other. And, it may be the best for them. It doesn't mean it's the best for you. We sat down, drugs and doctors were in network, so I went ahead and switched them. And then he comes back and he says, oh, it was Anthem. It's like, so just let the expert look at your plan, look at what your needs are, look at what your wants are, and let us help you figure out what the best plan is for you.
Mm-hmm. Definitely. And then I also wanted to bring up, I think a lot of people were really nervous about this year, things that are in the media, copays are going up. That's to be expected because of inflation. Prices go up every year, but also the insurance carriers are still feeling the effects of the Inflation Reduction Act. So that cost got pushed on the insurance carriers, not the drug manufacturers. So that's why you're seeing some of those extra benefits go away and the plans aren't as competitive as they were a couple of years ago because the carriers such as United Healthcare, Aetna, Essence, Humana, they're not as profitable as they were a couple of years ago. So until all that evens out, we're not going to see those extra benefits as
robust.
Yeah, as they were a couple of years ago. So yeah, it'll take a couple of years to even out. So.
And I just want to give a real quick example because most plans last year for a tier 3 drug standard was $45 or $47 copay. And this year what we're seeing on a lot of the plans is they've switched from a standard copay to a co-insurance, a percentage. Mm-hmm. And a lot of those are 25% for a tier 3 now. And we talked about this. Some drugs will be cheaper. Some mm-hmm. drugs will be more. It depends on what the retail cost of the drug is. So today I had somebody come in and they're on an inhaler and, if it's 25%, it's going to be a lot more. And you have to also watch that drug deductible. So mm-hmm. he was able to switch plans and save over $1,200 a year just by switching to a different company. It's important because we're talking thousands of dollars a lot of times that you can save.
Yeah. And that's just for that person and people that are on a lot of medications. If you're not on a lot of medications, maybe you need a procedure next year, or you are interested in the extra benefits. Maybe you need a crown. Dental can be very expensive. So it's just so individual to you. That's why it's important to talk to someone. And also that's local, because we know the local networks and can make sure you're in a plan that has great coverage.
And another thing that comes to mind is, a lot of times I'll sit down with a couple and they'll go with two different companies, two totally different plans, because they are two totally different people and with two totally different needs. So you don't always have to be on the same plan as your spouse. It's individual.
Yep. Good point.
And we just wanted to hop on here real quick. We've had a long day, but it's been a great, productive day. We were able to help a lot of people, and help a lot of people save a lot of money. So we just hope everybody has a nice, safe night.
And we're not in a rush. We have until December 7th. So our schedules are booked up for the next month pretty much, but there's no rush. If you make a plan change today or in December or the end of November, your plan will still start January 1st. So we wanted to point that out too. But
yeah, so that's true. So just be patient with your local agent, because we want to go through everybody's plan and we want to sit down with each and every client. So it takes a while. So we'll get everybody in, but just be patient.
Yep. All right.
Have a good night.
Bye.